Thank you for being here tonight to learn, share, celebrate, and dream, looking towards increased access and support for families impacted by substance use, and specifically supporting Friends of the Haven as a critical partner in this work. My name is Kaylin Klie, and I am a physician who specializes in perinatal addiction, taking care of pregnant women and women around times of pregnancy with any substance-related concern. This work is deeply satisfying, but not work that can be done alone. And I rely heavily on our community partners, such as the Haven, to provide the level of care that so many of my patients need in order to be successful in their recovery from substance use. Pregnant women have not been spared in our most recent substance use epidemic, starting several decades ago now with opioids, evolving more recently into fentanyl, a particularly potent and deadly synthetic opioid, and current trends projecting increased deaths related to methamphetamine overdose in the coming years. We are still on the rising tide in our country's struggle with addiction. What was once called the opioid epidemic is now more accurately described as a multi-substance epidemic. Adding to this has been our global pandemic, with people with substance use disorders being among the most vulnerable, socially, medically, and economically. The need for evidence-based treatment for people with substance use disorders and their children has never been higher. How does untreated substance use in pregnancy impact our community? While the outcomes for women and their children who use substances in pregnancy and do not receive timely treatment are variable, some of the most devastating outcomes include maternal overdose and maternal death. I have the unique honor of serving as the co-chair for the Maternal Mortality Review Committee for the state of Colorado. We review each death that occurs in a woman during pregnancy or within 1 year from the ending of a pregnancy episode. We are tasked by the CDC with determining cause of death, contributing factors, recommendations for improvement in care, and whether her death was preventable or not. In Colorado, as in many other states across our country, traditional obstetric causes of maternal death, such as bleeding, infection, or blood clots, have continued to decrease, while deaths of desperation, suicide, and substance overdose have now emerged as the leading cause of maternal death. In Colorado, substance overdose and suicide have been our #1 and #2 cause of maternal death every year since 2012, when such data began being counted in this manner. And in reviewing these deaths, dozens per year, every maternal death due to substance use was determined by our committee to have been preventable. A mother who would be alive today, and a child who would have had the chance to know their mother. Substance use disorders in all people, including pregnant women, are preventable, treatable, and manageable. Pregnancy in particular is a unique opportunity and window of motivation for many people to be more receptive to treatment than other times in their lives. However, placing pregnant women into traditional, non-gender specific, and non-trauma informed treatment settings is not best practice and likely to be less effective. The most successful outcomes for women and their families come when women receive treatment tailored to their unique needs and are not separated from their children. The women I care for, women who benefit from the Haven, are strong, resilient, and often cycle breakers of generations of trauma and addiction in their families. But they cannot do it alone. Substance use is a disease of isolation. And so the treatment, the healing, comes in community. Supporting the Haven in whatever way you have to give, whether that's volunteered time, mother or baby items, monetary gifts, or some other unique contribution that only you can make, your commitment and support for women and their children is life-changing and life-saving. Thank you.